In the fall of 2023, I was backpacking in a remote wilderness in Montana with a friend of mine, and I slipped on some wet vegetation, and I knew I had done something to my ankle and leg.
Bill is an incredible patient. Unfortunately, he had a pretty large defect in his ankle joint. And unfortunately, these lesions are often relentless and progressive, and they can really result in destruction of the entire joint. So what we're trying to do is joint salvage procedures, hoping to prevent him from ever needing a large procedure like an ankle replacement or a fusion procedure.
The question that Dr. Gianakos and I were dealing with was what was going to happen with the ankle. There was damage to the bone and cartilage there, causing me pain and swelling, and was potentially going to predispose me to having further degeneration of my ankle.
One of the things that I was very fortunate to have training in is an autologous osteochondral transplantation procedure. And essentially this is where we take a cylinder of cartilage and bone from a non-weight-bearing portion of the knee joint, and we transfer that and transplant that into the defect area where there's injured cartilage in the ankle, which is in the talus. So this is something that we originally did for him because unfortunately he was not able to be active, and he's a very active individual, and this really affected his livelihood. We actually had an MRI which demonstrated that the graft took very well, but he was a great candidate for an arthroscopy procedure, particularly a needle arthroscopy procedure, where we could go in through a very minimally invasive approach, take down all of that scar tissue, take away all of the bone spurs that he had developed that were blocking his range of motion, and also perform a second look arthroscopy where we could actually look at our transplant and that graft to see how well that took.
It was totally fascinating, the whole thing. I was able to watch her going in, but I was also able to see on a video monitor exactly what she was seeing inside the joint using these surgical instruments. For me, to get to see everything was really, really cool.
That's FLICA.
FLICA, yeah.
I'm a biologist by training. I'm interested in understanding what's going on. The instruments are so amazing. The arthroscope itself is less than 2 millimeters in diameter. The other surgical instruments are also designed to go into these tiny holes. So she's not even making an incision per se to do the surgery. It's just two tiny holes that she goes in through. That means that there's much less trauma to the tissue. It also means that when she's done, she doesn't put any stitches in.
So with new technology, we're trying to create instrumentation that's smaller in size. And the goal is to provide patients with an alternative that is more minimally invasive so that they can get back to their activities quicker and safer and more efficiently. Bill is someone who's an avid hiker. He's able to walk within a day. He is getting back to hiking already, and it's within a week. And he's very happy because he didn't have to require any post-op narcotics. The pain was well controlled with just some Tylenol after the procedure, and he's able to return to work within, by the next day he was back at work, which is really exciting for him too.